Are struggling. This is a really difficult time for them right now.
Pre-pandemic nurses were already showing signs of burnout, and now the situation's only getting worse as pandemic fatigue sets in. That's the warning from the president of the BC Nurses Union. She says as nurses either get sick with COVID or get exposed, they have to take time off, leaving fewer available for patient care.
So what I hear from nurses across the province is nurses are being asked to work extended shifts in acute care. That's beyond their 12-hour shifts. There often is no one to come in and be able to replace them, which causes enormous moral distress for the nurse who does not want to leave their patients, but has family commitments and other reasons, and from exhaustion needs to go home. We also hear nurses working extended numbers of shifts, nurses working 10, 12, 16 shifts in a row.
And she says in regards to getting personal protective equipment, frontline workers still don't have unfettered access to PPE.
It is still being rationed. In many cases, it is locked up. Nurses have to ask for it, or they have to go and pilfer it off another unit, which I think is horrible. And nurses are having to wear masks and other PPE beyond the extended life of that mask.
With the 7 o'clock noise making tributes gone quiet, some are taking notice and trying to support as best they can.
It leaves people feeling positive, relaxed, connected.
That's Andy Day, CEO of the BC Parks Foundation. Just over a week ago, they launched Parks, Canada's first national evidenced nature prescription program. It gives practitioners the ability to prescribe time in nature and receive a 90-minute nature therapy session. Parks also launched a special pilot, reaching out directly to nurses and doctors.
How did those healthcare workers take to it and find that?
I think, one of them said, boy, this is better than any pill I could ever take. But yeah, I think, there's a certain coming into it, a little bit of skepticism or maybe nervousness, like what is this and how's this going to work? But within, 5-10 minutes, I think everyone just said, wow, I'm feeling really grounded and relaxed here, and you can hear it in people's voices.
He says while these sessions are designed to be more impactful than a walk in the park, any time spent disconnecting in nature can be part of the solution to help those stretched too thin.
A good long session in nature can have benefits for up to 30 days.
Meanwhile, Sorensen says even though we don't hear pots and pans like we once did, she believes nurses know they are appreciated.
I think nurses know that the public holds them in very high regard.
And when asked how we can help
us reduce the spread of this virus.
In Vancouver, David Zura, City News.